I'm Dr. Tara, and this is Hopeful Hints, a podcast where you'll receive quick, hopeful hints on all things women's health and infertility. Here you will find education, inspiration, and most importantly, find peace and empowerment as you walk through the next steps in your healthcare journey. Welcome to Hopeful Hints. I am your host, Dr. Tara, and if you're watching on YouTube, you will see my background is different once again. At time of recording, I am currently in California for my egg retrieval for IVF. So I decided I don't care what I look like. I don't care what my background is. I'm just going to pick up the mic and we're going to record and we're going to keep talking about infertility because we don't talk about it enough. And in fact, right before time of recording this, I was talking to the lovely Miss Ashley Berry. She has a book, but she also has a movie. It's on Amazon Prime. It's called 4, and it is about her fertility journey. And I said to her how to screenwrite and get a movie filmed, and she did all that, and she's from North Dakota. So I encourage you, please go support her. Download the movie 4. If you're going through infertility, this movie's for you. And it's about her journey. And she's an open book. We're going to be doing some live movie viewings if you're local to North Dakota. But that also, if you're not local, she will do movie viewings for you no matter where you live. So I encourage you to check it out and know that you are not alone in this infertility journey. There's a whole team of people behind you who have gone before you, and just a lot of what I talk about is things that I've learned through my own journey, speaking with the top docs in the country. And in talking with Ashley, where I'm going with all this rambling, is she still to this day does not know why she can't get pregnant. She's never been pregnant. She's never had answers. She's been told unexplained infertility, maybe PCOS, and she's 38 and has no answers. And so many of you can relate to unexplained. As you heard in my previous episodes, I don't believe in unexplained infertility. So when she called me, I said, I want to go medical for you on a second. Can I ask you some questions? And I did my screen that we do in my practice where we're able to identify endometriosis, PCOS, things like that within the first 10 to 15 minutes of talking with our patients. And we can usually identify the root cause of unexplained infertility. I have all my providers trained on this. On that first visit, we know what road we're going down. And I can truthfully say there's no one that has entered our practice that has walked out, whether we refer them on to a fertility clinic or treat them in our practice and successfully get them pregnant, that still has unexplained infertility as their diagnosis, because I think it's garbage, as you know. So I want to continue this conversation on this podcast episode, sharing about hidden clues, symptoms of infertility that you should not ignore. And I want to inspire and empower you that you can take this into your own hands. Don't let where you live be a factor. When I first started going through infertility, I was living in rural North Dakota in the middle of nowhere. And it's hard to get access to quality care. And that is another reason why my practice offers telemed in 5 states. I do coaching anywhere in the world personally, so I can help you personally no matter where you live and get you answers and point you in the right direction sooner. You shouldn't have to wait like Ashley or myself and be 38 getting excision surgery, being told you have stage 4 endometriosis, adenomyosis. That's been my cause the entire time. You shouldn't be like Ashley sitting there to this day with no answers. You should have answers. And whether you're closing your fertility journey door or not, and you still have unexplained, like Ashley and I said, sometimes it's just necessary and needed and helpful to have an answer at the end of the day and have a why. Dive in. I want to talk about how your body knows you best. And it often has little whispers, I call it, that are subtle hints of what could be going on. Subtle changes, irregular cycles, skin changes, mood changes. And they're often signs that something deeper is going on, hormonally or structurally. And they're overlooked by many providers. It's not just a couple of them. It's a lot of providers overlooking this. And too often these clues are, again, when they're dismissed by the provider, then you just assume, well, this is just how it is. This is normal. So I want to walk through just a few of them today. I want you to start listening to your body, getting a second, third, or fourth opinion, and starting to take these symptoms serious. I hope Ashley doesn't mind, but I'm going to use her a little bit as an example. We start out with period conversation. So we begin by talking about your cycle and how this might change. So she was sharing with me how her cycle changed. It used to be pretty light, pretty inconsistent, maybe bled for 3 days. And then she did IVF years ago, and they've been heavier ever since. So what I want to use as an example here is how the cycle changes, whether it's due to medications or fertility treatments like she did, but also if you've had a child and it could be the second or third child and now your cycle changes, that's a red flag. So one thing we look at is short luteal phases, like less than 10 days. And it can indicate low progesterone. And when we have low progesterone, it makes it difficult for that embryo to implant. Like, duh, medical providers. And so if your period's coming too soon, it might not be producing enough of the hormone that's needed to support that pregnancy. If you have mid-cycle spotting, this can be an ovulatory dysfunction as well. If you have pain with ovulation, symptoms during ovulation, that is such a red flag. We know that heavy bleeding or large clots is a red flag, but we need to rule out fibroids, polyps. Often this is a sign of adenomyosis and also endometriosis. And those are things, all of these things I just listed can truly interfere with conception too. Or if you're having miscarriages, these are red flags for that as well. If you have irregular periods where they really bounce back and forth between 24 days, then 31 days, and that's kind of what was happening with her too, that is a red flag. If your cycles are 35 days, sometimes I will even say in our practice 32 days or longer, that's a red flag. And many of you are not taught or have the tools such as home hormone kits to be checking these things at home too. And your providers aren't helping you with that. You're using the junky garbage over-the-counter flashy smiley faces and getting such mixed signals from them. Throw those ovulation kits in the garbage. But this is a sign of PCOS, thyroid dysfunction. All of this can not only prevent implantation, but also ovulation or delay, or you're missing. You get 24 hours to catch that ovulatory time frame, and can really, when your cycles are fluctuating like that, make it super hard to even catch that or know when you should be trying to conceive. Hormone clues. So let's go beyond your cycle now and talk about some signs that are red flags, from mood, cravings, metabolism, skin, energy, sleep. So persistent fatigue. Like if you are sleeping long hours, or you're even just getting like high quality sleep and you're still fatigued all the time, that is such a red flag. From insulin to thyroid to hormones, it is a red flag. Mood swings. So what we talk about a lot, and I'm going to have a whole episode, it's PMDD Awareness Month as well, premenstrual dysphoric disorder. So we always ask the question, days or weeks before your cycle starts, is there any symptoms at all that you're like, oh, here comes the cycle? That is a red flag. You should actually roll into that cycle with very minimal noticing that you're about to start that cycle, believe it or not. But we look for mood swings, depression, irritability, anger, rage, sadness, crying, fluctuation, all of the above, a whole soup of that. Bruising, bleeding. Again, I'll go over PMDD in a different episode. I have some other episodes on PMDD if you scroll back too, but these are not supposed to be happening and are a sign of an imbalance going on that will impact your fertility. Acne, that jawline, chin, neck area can also be hormone imbalances going on. If you're doing basal body temperature checks and you see erratic charts going on and fluctuations, we need to look at progesterone and thyroid. So cycle tracking isn't just about ovulation. It's actually a useful insight into your hormones too. And we have our patients try, if they can, to invest in those home kits or systems because they can be used beyond conception too. We can use them into perimenopause, into menopause, and really be checking your hormones at home your whole life. Painful intercourse is another red flag that's not talked about enough. So we think endometriosis, pelvic floor dysfunction, inflammation, very common. One of the number one signs of endometriosis is that. Excessive hair growth to your face, your chest, your nipples, your belly, your arm, that dark hair growth is a red flag. You don't have to have that to have PCOS. So many patients will not have that and they still have PCOS. So PCOS is also extremely underdiagnosed and a super common cause of infertility. that we treat daily in our clinic as well. We also need to talk about the GI system. So if you're having GI concerns, bloating, reflux that's not controlled by meds, we don't want you on meds. So if you're a young female having reflux, red flag. If your bowel movements change during your cycle, red flag. If they change before your cycle, any GI stuff as well is super red flag. Cold hands, feet, nail, hair, skin changes. If you're having circulatory issues, there's so many autoimmune conditions, let alone that we are finding in our practice too. Those are not supposed to be happening. You shouldn't have those things going on and just being dismissed or overlooked with them. So what do these point to? Like, what is the cause of this, Tara? Like, right? Like, you're talking about finding out the root cause. Well, again, I just said PCOS. Again, super misdiagnoses or by healthcare providers. It kind of sort of maybe looks like it, or I've had so many patients come in saying, maybe have this. Healthcare providers, please go and get trained on PCOS. You are missing it left and right. But you can have a normal period that comes pretty standard and still have PCOS. Or, of course, the number one thing of PCOS is irregular absence cycles, but even further, it's ovulatory. You're not ovulating. Well, who the heck is sitting and checking their ovulation that much? We have to go into other symptoms. So we look for signs and symptoms of elevated male hormones or androgen levels, which again is that acne, oily, greasy hair, oily, greasy skin, just so many other things, right? What I want to point out here is you do not have to have polycystic ovaries on an ultrasound to diagnose it. There is clinical ways to diagnose this, and in fact, I've been talking more about this, but we use AMH levels. There were some new guidelines that came out to utilize AMH levels that are 4 or higher. And yes, you can have lean PCOS. So you can have normal weight, you can be super athletic triathloner, and still have PCOS. We see this all the time. You don't look, my provider said I don't look like I have PCOS. Like, what does that even mean? Knock it off. The other thing I want to talk about is thyroid dysfunction, which, man, I am so lucky to have a crew of providers who are thyroid gurus in our office. But 2.5 is actually what's considered suboptimal for fertility. So why is 2.5 not suboptimal for women in general who are super symptomatic? Like, hello, healthcare providers. I feel like I'm like yelling at healthcare providers in this episode, but seriously, please go get some training. We have to also check your free T3, your free T4, your antibodies. None of that's ever checked when they come to our office. It's just really sad. So again, I did talk to Ashley and I said, I really want to check these levels in you as well, and really just rule that out too with some of her cycle concerns and some other symptoms that she had talked about. So they're super important that you're working with a healthcare provider who understands the thyroid and takes it serious and treats it, and doesn't stop those medications either at any point when levels are not optimal or you're still symptomatic. And then, of course, I feel like I've ranted about this enough, but endometriosis is truly the number one misdiagnosis or diagnosed too late. Like, I think of a dear friend that comes to my mind. I think she's 43, maybe 44, went through surrogacy and still is told to this day that she has unexplained infertility. And I know they're going to find endometriosis when she has surgery this summer. I just hang on to hope for women again, whether they're going to continue their fertility journey or not, I don't know. But I find that too many women are told too late. We're finding, menopausal women and they went through infertility and still don't understand why they had it either. They were told unexplained, and I send them for excision surgery and they have endometriosis. So really keeping endometriosis at the forefront of that diagnosis. I want you to get a home system or home kit for tracking your hormones. We love Uva. We've used Mira in the past. There's Prove. There's lots of great ones out there. I want you to make sure you're able to check your progesterone, and you can pair them with the basal body ones as well and all the other fun cervical mucus ones, but make sure you're doing home urine kits as well, tracking them in apps. Don't think that you're over tracking. Take the notes, write it down, use your notepad on your phone. And it's great information for your provider to have. We'll figure out why it's happening. Again, if you're in the hands of a good provider, just put it in the app, put it in your notes, and let us know what day it's happening on. And then make sure you're getting a true fertility workup. Or There's a lot of home kits you can do too, and blood work that you can have done on your own, and then taking that data to provider. Don't forget fasting insulin. We're looking for insulin resistance. We see that greatly impacts cycles as well. Free and total testosterone, DHEAS. Of course, your cycle labs, which are usually typically day 2 to 4 of your cycle, FSH, LH, estradiol, AMH, prolactin, vitamin D, B12, all of those are very important as well. If you live in the Midwest, I know you have low D, so just get on some, please. But I want to end this by saying, you know your body best. You are with it 24/7, not us healthcare providers. Your body is speaking to you, even if it's just a light whisper, listen to it. Don't wait. Get a second, third, or fourth opinion. Find a new provider if you don't feel like you're being heard or something's off and you're looking for answers and you're not being taken serious. Know that there actually is providers out there who do take these things serious. You deserve a provider who listens. I'm a message away. I'm always here for you. So send a message and just know that you are worthy of getting answers. Thank you so much for listening.